The average solo GP is dead. Being handcuffed to a practice that only makes money while you're drilling crushes your freedom. Being trapped at the office is no way to experience life. And doing more fillings and crowns ain't the answer to freedom. Stop it. Freedom comes when your practice makes money without you. Freedom is choosing how many days and how you dental. Ready to forge your freedom? Then keep listening to become a super GP and super CEO. This is the Titanium Practice Podcast with your host, Dr. Stephen Freeman. Let's go.
Hello, all you beautiful people, and welcome to what's sure to be the best episode of the Titanium Practice Podcast yet. I'm your host and personal freedom coach, Dr. Stephen Freeman. How y'all doing today? So before we get rolling, as usual, please hit that subscribe button and leave a review if you can. I'd really appreciate it. Really helps things out and making sure that everyone gets this information. So if you're enjoying it, please leave a review. Let us know how we're doing. Also, if you head over to titaniumpractice.com and sign up for our free newsletter, it goes out at the beginning of the month. And we'd love to have you on there so you can get all the latest and greatest information that I've got for you. Okay, let's get moving. So today is going to be another Titanium Nuggets episode. And I've been doing almost exclusively implant nugget episodes so far. I thought I'd drop a new one because I love it. And I know all of y'all hate doing traditional ortho. I know you do, but hear me out, okay? Just hear me out with this. So we're going to talk ortho today. I want you to think about a couple of things before we dive into it, though. Most of what we hate about ortho has to do with things that you think you have to do because if you did any ortho in school, you had to do a bunch of minutia, a bunch of things like taking off rubber bands, placing brackets, things, and you also you didn't understand any of it because how much ortho did you get in school? Practically none. I know we've gotten more into Invisalign, and I'm actually going to start out with Invisalign here in just a second. But so much of ortho can be delegated. And these assistants, it's crazy to me because I started to think about general dentistry assisting. Think about, and if you've got a huge suite of procedures that you do in your office, think about all the procedures that you expect a dental assistant to be proficient at. Tell me that doing a Class 2 composite has anything to do with extracting a tooth. They're two totally different things aside from the fact that they're done in the mouth. Other than that, they have nothing in common. Nothing in common. The actual procedure itself, nothing in common. Once you numb, they're done. Okay? We ask general dental assistants to know so much. If you dabble in all these things, they never really get great at doing any one thing. They can probably do crowns and fillings pretty easily at this point in time. Those are pretty similar to each other, relatively speaking. But extractions, implants, ortho, if you really start down the rabbit hole of doing traditional bracket wire ortho, at some point in time, they either get trained up on doing that, or you can bring in a specifically trained assistant who's an ortho assistant. These gals are amazing. They do basically the same things all day, every day, and they get really freaking good at doing it. Really good at doing it. To the point where, and I've mentioned it in other podcasts, where basically my orthodontist just walks around giving people fist bumps all day long. Like, hey, how's it going? Your brace is looking good? Awesome. Well, she's going to do X, Y, and Z, and we'll see you back in a month or two. That's it. That's what orthodontists get paid to do. It's insane. It is the easiest freaking job out there. And I kick myself, and I thought about going back into ortho residency because it is just so easy when you pick the right cases. So I'll start off by saying right now, case selection, first nugget, class 1. Class 1. Don't go fishing and try to do class 2 and class 3. Class 1. And this is going to be 80% of the patients walking through your door. Okay? So first and foremost, if you're just beginning in any type of ortho, class 1. Okay? You don't have to worry about the bite then. Moving the molars is the hard part. Moving anterior teeth is easy. It's super simple. It's so simple to do. So to get into the ortho game, I do think clear aligners are a great way to at least get into it. I mean, it's, again, totally different procedure than doing a filling. Totally different. So if you want to get your feet wet, get into doing Invisalign. Or some other brand if you want to do some other brand. Because it is a great way to begin to think about what orthodontics can do. Now, most likely I'm preaching to the choir. If you're listening to this, you're probably already doing some type of clear aligner. If you're not, you're leaving gigantic amounts of money on the table. I also recently talked about how I got into the 3D printing game not long ago. 3D printing forever will change clear aligner therapy. You can now print these things in your office for a total case price of like $250. And even less. If you go down the rabbit hole and you say, well, I'm going to do a ton of these, you can actually buy like OrthoCAD and it'll design the whole damn thing for you, and now your price plummets to like $50 a case. Invisalign charges you about $2,000 for a full case. By the way, that would be my other nugget for you, is I almost never, ever do a full Invisalign case. Almost never. I'll tell you why. 2 things. 1, their limited version, where they give you 14 trays, comes with 1 correction. So you get 28 trays for less than half the price. No one wants to be in these trays for longer than 6 months. Or I should say almost no one. You'll get the occasional patient who's like, oh, I'm fine, I'll continue wearing them, it'll be great. And I guess in reality that's closer to 8 months. So 28 trays is, closer to like 7 months by that time. That is the limit that people want to stay in trays. When they first get it, they're all excited and they're all into it and they're all wearing it and it's great. But by the time you get to the end, they're done. And even if you have to pay for a correction, you get another 14 trays for $150. So for 60% of the price of a full case, you can then have 42 trays. Now you're closing in on a year. No one wants to be in the trays that long. You come out financially way ahead. And that's what I would tell patients. I tell patients, hey, you're going to be all excited at the beginning, and towards the end, you're not going to love it so much. But the good news is your treatment's going to be fast. And you got to tell them to be fast because everybody thinks ortho is going to be expensive. Everyone thinks ortho is going to take a long time. So I hammer away and focus on how fast it's going to be. Because the thing is that you're still going to charge the same amount and they're going to get a fantastic result. But in their mind, part of the value in all of this is the length of time that they're actually in treatment. And you'll have people get pissed if it takes 3 months. You know what? If you're not into ortho, you have no idea how great of a smile you can give someone in 3 to 4 months. And that's aligners or traditional braces. you can give them a fantastic smile in a short amount of time. It takes about a month, and I tell patients this, it takes about a month to wake up those teeth. That's exactly what I say. It takes about a month to wake up those teeth, to get them wiggly. And then after that, zoom, they start moving, and they move real fast. And you will have patients who you will have them come in for their checks or maybe their recare exams or something like that, and you look at those teeth and they are moving. And the first time you see it, you're going to poop your pants. I mean, you're going to look at it and you're going to say, this is nuts. This isn't the way it's supposed to be. It's cool, baby. It's cool. It's exactly what's supposed to be. Do not worry. They're absolutely fine. So they get moving about a month into it. And after that, you can just keep making corrections. So I've worked with Invisalign enough now that I actually have them change their trays every week. Once a week, they change their trays. So with me, they're done in 3 months. That's why I keep getting this timeline. And I guess I should have backed up and actually given that timeline before, because most of the time y'all are doing it in 2 weeks. I do it in a week. Switch your trays out. Let's get moving. Let's get done. But if you do the limited cases, then your cost to doing this comes down so much. The patient gets a great result. You still get points, by the way. They used to not give you points for doing limited cases, so you can get discounts, but they now do that. So that's great as well. I think they changed that about a year ago, in case anybody hasn't done a limited case in a long time. But that's nice that they start giving you the points back for it as well. My orthodontist doesn't really like using Invisalign in full, because part of the deal is the fact that in transparency, he likes using 3M products for his traditional brackets, and we're going to talk about that here as far as doing traditional ortho is concerned. He likes using the 3M products, and so that's where we end up using their 3M Clarity, and it works out fine. He likes it. It's great. Use what works for you. So our price comes down considerably. We're only paying like $1,000 a case at this point, because we do a lot of it, and it works out great. So you may want to check out 3M's Clarity if you want to do that. But as I started to say, is again, 3D printing. That's all they're doing. They're printing these things at their place. And so right now, SprintRay, which is the printer that I have, the only thing you can actually do is you print models, and then you do a thermoform suck down over the model, and that's how you make these trays. I don't want to do that. That sounds like way too much work. Yeah, I could probably delegate it to a staff member, but I also think ultimately they'll probably hate it as well, would be my guess. There are companies, Great Lakes just came out with a printer that will print their material directly. And I know SprintRay has theirs coming. I was told it's supposed to be released at the AAO, the American Academy of Orthodontics meeting, which is coming up in about, it might even be this weekend now that I think about it, but very soon, beginning of May. And once I can print directly, oh, look out. Look out. I mean, that is the total and utter game changer, because if you've got the software, and the software typically costs about $5,000 to get it, but think about that. If an Invisalign case costs $2,000, how many of these cases do you have to do before you've actually paid for the program? And now you get it. Now every case is designed for free for life. I mean, you still have to pay for the resin, but the resin's free, guys. It's free. Man, get a printer. Get it yesterday. Start dabbling with it. And I think, like I said, they just came out with 2 new printers that are going to be released here shortly. One that's designed more specifically to have a higher ceramic concentration for the crowns, called the Midas, and then another one called the Pro 2. And that one will be replacing essentially the printer I got and the bigger batch printer that they used to have as well, that I was planning on getting. But I'm fine with that, because I'm probably, there's still a learning curve, guys, to learn how to do this stuff. So I'm going to print stuff, and I'm going to come close to paying off that printer, if not more than pay it off by the time these new printers come out. Probably let a couple roll off the production line first and let them figure out the bugs, and then I'm going to buy the new ones. Because it's just that transformative. And what? I've sunk 30 grand into this to be able to save tens of thousands of dollars. I mean, it's what a great ROI. So, you know, and then you can print the retainers too. That material I know is coming. That's coming at the AAO. I thought the print directly is, but I mean, if you can print these things directly, why wouldn't you? Do you imagine having someone come in and be able to print these things in like an hour and be like, here are your trays, ma'am? It's so transformative. I'm considering opening an aligner only office. So I'm in the early works of doing that, and I don't even have the product yet, but that's what the future is. That sounds amazing to me, to be able to have all of it in office and doing it. I mean, it's just, to be able to print that is incredible. So get in the game, get into Invisalign. I preferred Invisalign personally over some of the other ones. I tried SureSmile, that didn't work in my hands. Clear Correct didn't work in my hands. The only one that seemed to work for me was Invisalign, and of course it came with the highest price tag, and that was awesome. Couldn't do any of the ones that were cheaper, which would have been way cooler. But that is how you can get into the game. You can think about tipping and rotating and seeing what works in ortho. But almost all of it can be delegated. Almost all the attachments put on are delegated. The only thing I really end up doing is the IPR. That's about it. I mean, they can polish the attachments off. I mean, IPR, that's what you got to do. And do not get me wrong. I hate IPR. I do. It's miserable to do. And I've always tried to kind of come up with a way to do it better and faster. And actually, I just saw a new burr yesterday that I'm going to try out. So I'll keep you up to date on using that to see what my orthodontist thinks about using that burr for IPR. But that's it. You've got to do IPR. Oh, and I started to say reasons you would get into ortho. So if everything can be delegated, that means you just get to walk around and have fun all day long. Okay? You just get to walk around and have fun all day long. How great is that? How stressful is your job right now? Has anyone ever given you a hug for doing a class 2 composite? No. No one's ever given you a hug for doing that. My orthodontist gets hugs all the time. And I hate people touching me. But I'd rather get hugs than people be fearful and pissed that they have to be there to get the thing done, it's their fault that they have to be there. It's the easiest thing, the closest thing we have to want-based dentistry that's easy to do. Now, you can do veneers. I mean, veneers are so much harder to do than IPR. To get people happy with them, I mean, there's so much. I mean, in fact, the easiest way to do veneers is to put them in some type of orthodontics first, make that mandatory, and then come back and do no prep veneers. That's how you do veneers. There's another nugget for you. So, I mean, make it mandatory. And don't just think about, I want this money so badly that I'm going to do this even though it's going to be, harder to do. Make your life easier. Set them up. Do no prep veneers then. That is the way to do cosmetics. That's a simple way to do it. And just bake it into the price. And you can choose to maybe charge a little bit less to do it, but because you're going to finish it off with the veneers. But man, set them up with trays, and then don't prep them. And then all you get paid to do that at that point in time is to bond, IPR and bond, clean up cement, which is a pain in the ass. But I mean, that's a game changer all by itself. So other things to consider is like, how many dentists go deaf because of that drill? How many dentists have back problems? Because you contort your back all day long, even if you've got loops, which, God, you better have loops. Don't even talk to me if you don't have loops, because, my God, how are you seeing these teeth and seeing what you're supposed to do? But you're contorting your back. You got this high-pitched drill, making the sound in your ear all day long. You're contorting your back, trying to keep the tongue out of the way, all while Miss Jones is, not willing to swallow her own spit. I mean, my God. Think about it. Now IPR, It's a little uncomfortable for the patient. You might get a little pushback, but you get it done pretty quickly. And it's once you're through it, you're done. That's all you need to do for that case. And you give them their trays and say, I'll see you in 14 trays. That's it. That's what I do every time. See you in 14 trays. We'll see how you're doing. Call us if you need us. They'll call you. If the trays aren't fitting, they'll call you. So I'm talking about longevity of your career here. I'm talking about making your standard or your health span and your standard of living better, not just financially, but just the fact that your back's not going to hurt. How many of you have a hurt back that hurts? A lot of you do. A lot of you have hurt backs that hurt because you got to do all these crazy contortions to be able to see, the distal of number 15 in order to do a $115, PPO composite. My God, why not get paid $5-6 grand to do some IPR and see them every 3 months and say, hey, you're doing a great job. Way to go. Way to keep wearing those trays. Well, we got another 3 months to go and you're done. It changes everything. It absolutely changes everything about your life. And it'll prolong your career. And you may say you don't want it prolonged, but if it's more enjoyable and it's easy to do and it's rewarding and fulfilling and you just get to do the cosmetic thing. And I started to say that want-based thing, people buy what they want. They don't buy what they need nearly as readily as they do what they buy what they want. The greatest job in the world, a plastic surgeon. Everyone likes boobs. Everyone does. Everyone does. Women do, men do. And women want to, spend money on stuff. And most of the time, if it's a bigger purchase, they've got to go to their husband to get approval to spend $5,000, $6,000, $7,000 to do the boob job. The husband's all over it. They're like, absolutely, let's do it. Oh my God, what a great business model. And so the closest thing you've got is doing orthodontics. It's the closest thing because everyone wants a nice smile. Or almost everybody wants a nice smile. And then when you get into doing kids, and see, that's my thing, is normally I typically do clear aligners for adults and do traditional orthodontics for kids. Because you gotta be, it's more bite focused at that point in time to make sure that the kids have a perfect bite. Because adults, most of the time, all they care about are the social six. That's what they care about. They want to have a good looking smile that they can post on Instagram. That's what they want. And you talk to them about it. It's like, hey, we can fix some things in occlusion, but they're not really concerned about that because they can eat and they're not having problems, or else they would have brought it up to you. With kids, I'm a little bit more particular in saying, no, let's dial in this bite. And if they really, give pushback, we'll say, well, here's the limitations of it. This might not be the right product for you. You still want it? Great. Here we go. But then you've got parents on board setting up for orthodontics. That was the point of saying all that, is that you've got parents on board and they've got, a lot of the kids will have ortho coverage too through their health, through the dental insurance. How great is that? So the thing that was going to be $5 or $6 grand is now $3 grand, and you break it up over some monthly payments so they can afford it. Maybe do a different pricing if they're going to pay in full. Bang! Money in your pocket that you just get to walk around being happy, giving fist bumps over. Hallelujah. Okay? So I actually talked longer about aligners than I thought I was going to give today. So I didn't really talk too much about traditional ortho. So we'll do that one at another time. But I wanted you guys to get into that mindset, because I know a lot of folks don't even want to get into Invisalign or clear aligners. You can delegate all this stuff. That stuff you hate about doing ortho, you can give it to an assistant, because I guarantee you. So like Heather did when I was doing Invisalign, this lady Heather at my office, she did it. She loved it. She had a purpose. She had a home. She owned it. And man, if you tried to mess with her Invisalign, or like you did something wrong, or you submitted something and you weren't supposed to, oh my God, she was all over you, and I loved it. And it's kind of funny because she has a very reserved personality otherwise. You touched her Invisalign, oh, she got pissed about it. So my point is there's someone in your office that wants to own it. And that's what I keep saying about a lot of things. There are people in your office that want to own things and they want to have a greater sense of responsibility. And I think it's important, if you're getting into this, to have someone who's your point person to control it. Because if you get too many chefs in the kitchen, then all of a sudden you don't know if a case was submitted, you don't know who to talk to about it. So when you're getting started, there's a nugget for you. Have a point person. Have someone exclusively assigned to working on these cases with you so they know what you want done. And then they can take it and run. They take it and they run with it, and you don't have to do anything but IPR at that point in time. It's a beautiful, beautiful, beautiful thing. Okay? Speaking of that, thank you, beautiful people, for tuning in today. Again, if you can leave us a review, sign up for the Titanium Practice Insiders newsletter at titaniumpractice.com. I'd appreciate it. Tell a friend. Until next time, folks, thanks for joining me. Thanks. Bye.
You've been listening to the Titanium Practice Podcast with your host, Dr. Stephen Freeman. Please hit the like and subscribe button and follow us on Instagram, Facebook, and YouTube at Titanium Practice. Questions or comments? Send an email to info@titaniumpractice.com. Join us next time to help turn your average practice into a titanium practice.